Hi, hope all are doing safe and good. So today we are going to discuss about something called as dental pain because in this lockdown not all clinics open. Though I am working with my full time, I am working with all protections for myself as well as the patient. It is not that all other clinics also work. Might be very few of them in the city works. So in this time, if you get a dental pain, how to manage it? So here are the few tips I'm going to share with you in this video, and please like, share and subscribe. That will encourage me in doing more such videos. So what to do if I get a dental pain? So dental pain can be of 2 to 3 reasons. One is mainly because of your dental caries progressing very deep until your nerves and muscles that is stuck in a teeth. So what to do if you get a pain because of a dental caries or anything else such as your periodontal problem, your gum problem, might be sometimes they cause a pain causing bone loss in your teeth, etc. And some other reasons like trauma, etc. See, we don't have any other go other than trauma. If you get a trauma, you get treated. But if you are going to get pain due to your dental caries or any other periodontal or gum problems, there are some to some extent you can manage. So it will like which sort of dental pain we can treat, which sort of dental pain needs emergency and visit to a dentist. All your dental pain, okay, has to be treated by dentist, but in this lockdown situation, in case of emergency, suddenly you get at night 1 o'clock you have a severe tooth pain, what to do? So here I am going to share my first tip. So I always suggest whatever toothpaste you use, okay, take a small amount, a pea size in your finger, apply it over the tooth which you have pain. This will give a relief. To some extent, it will give relief because your toothpaste nowadays, most of your toothpaste we are using some herbal toothpaste or something, or normal toothpaste already we have a lot of astringent property in it. Most of them will have a thymol. If not, they have some clove mixed to it, etc. In case of toothpaste like Sensodyne or you have a Thermosil RA, where this toothpaste will seal your dental tubules or it can actually provide a barrier to some extent so that you have a pain relief to some extent with this kind of toothpaste. Sometimes when you apply your toothpaste, your pain itself will reduce to zero. Don't delay your appointment, but this is one of. So second, it is going to be your lukewarm salt water. If not, at least a good amount of salt water, concentrated amount of salt in it, preferably we say it as a rock salt in it, will do a fantastic job in management of pain, especially with that of your gums and periodontal ligament. So a lukewarm salt water you take, add salt to it, and it become lukewarm salt water. You take, you gargle in your mouth, split. So the gargling can be from around 1 minute to 2 minutes. That is more than enough. And people also say, and studies have also proven this salt water gargling to be very good against all your throat infections. Especially now at this pandemic time, it can actually kill your coronavirus. So salt water gargling, my second tip for your sudden toothache, what to manage in this lockdown. Next, a piece of clove. Okay, clove, a herb which we use in biryanis or kurmas, etc. or our sabzis. So what can this do is that you can take this clove, place it over the tooth which you have pain. This will provide even the huge oil is from this clove. This can provide a pain relief to some extent, and you can be free of pain as well. But in case of, like I said, the pain due to gums or some periodontal problem, if it is not going to be a tooth decay, make sure you don't apply too much of clove on your gums because sometimes it might cause a chemical burn. Now comes, what can I do if there is going to be a swelling or something, or all this what I said before haven't worked out? What can I do now? it is advisable you can take a 500 gram or 650 of paracetamol once or twice, so morning and night or morning, afternoon and night. But if it is going to be that unstoppable pain, the pain is not going off, please visit a dentist. And if it is going to be a swelling like pain, it needs emergency, it has to be visited, it has to be addressed, because you should be given an antibiotic at least for that swelling to go off. And treatment is absolutely necessary in case of unstoppable pain and non-reducing swelling. Saltwater gargling can help us in swelling, but it is always not to take risk with case of swelling, because a swelling to appear, it has to be a lot of infection, it has to be from a long duration of time that you have an infection in your teeth. Visit a dentist. And next, what can I do if there is no dentist? In case of a normal tooth pain or something without a swelling, you can actually visit your pharmacy. The pharmacy people will give you few medications. Nothing, your aceclofenac and paracetamol combination painkiller or diclofenac combination painkillers. Okay, so we can have that, and sometimes they might give you antibiotics of amoxicillin and metronidazole, but not more than that they could give. And some anti-ulcer drugs, like I'm saying in a layman term, anti-ulcer drugs like rabeprazole or pantoprazole. So this can actually delay your visit to dentist. It can actually provide relief for your toothache to some extent, and in case of an acute pain or reversible pain, this will have a very lot effect on your tooth. These medications will reduce a lot of pain, but it is not a permanent solution for your teeth, because the infection is still present, the cause for the pain is still present. For example, in case of tooth caries, the caries is still present, it is not removed. In case of your periodontal ligament problem or gum problem, the calculus of the tartar is still present and it is not removed. So it has to be treated. The main cause has to be treated. But if there is no dentist and it is under manageable conditions, this can be managed with this. And to where there are a lot other persons who's putting videos out, doing some steaming some water, having some puff with out of coconut shell, it will remove the worms from your teeth. To be frank, there is no worm in your teeth. The worm theory of your tooth dental caries has been one of they are not considered as a theory itself, because your tooth caries is due to bacteria, not worms, and this bacteria cannot be removed with that of coconut shell and boiling water. So it is just a myth, might be because they remove the pulp out of it, they consider it as a worm, but it is not that easy to remove the pulp also outside, because it has to be so open, and to that extent you can't bear your pain as well. So this all those methods they say is just a myth. Only thing you can do for your tooth is maintain it. If you get affected, you have to treat it. And in case of emergency in this pandemic situation, the three main ingredient I said you can help you out. First is a toothpaste. Take a toothpaste, then apply on your teeth. Number two, the salt water gargling. Number three, glove. Don't consider anything more than this. If this three is not going to work out, go for a medication. If medication is not going to work out, visit your dentist. Book an appointment with your dentist, and you can always visit them. I have shared my phone number and email ID in my description part. You can always take it, and if you need a video consultation with me, you can always feel free to call me and get a video consultation on video. So thank you all. Please like, share and subscribe, and that will encourage me in doing more such videos.